Very nice conversation there, Josh, with Professor McDaniel. We appreciate him coming in as well. While we're also talking about other topics, we cannot forget to mention the coronavirus. We are still in the COVID-19 pandemic despite increasing vaccination rates and more relaxed protective measures that the state is offering. So now let's bring in our another Capitol correspondent, Maggie Glynn. She's there live outside the Capitol. Maggie, thank you so much for being here too.
Thanks for having me, Will. Glad to be here.
First up for you, what bills have more of a chance that are passing that are more direct responses to the pandemic itself?
Well, a lot of these bills that are direct responses to the pandemic are making some conveniences that we experienced during the pandemic more permanent. So, for example, that includes going to the doctor's office. During the pandemic, there were several waivers that the governor put into place that allowed you to check in with your doctor simply over your phone or through your computer from the comfort of your own couch. And so now there's a bill that is very close to becoming law that was one of the governor's priority bills that's going to be making telehealth services more accessible online more permanently. So again, that's been an interesting one to follow because the technology has been there and the support from primary care doctors has also been there. But before the pandemic, there was a lot of pushback and red tape from insurance companies. But now lawmakers have finally kind of worked a way to get that bill to appease all of the different stakeholders, and that finally has a chance of becoming law. We're also seeing a lot of mental health legislation. That's another direct response to the pandemic. Obviously, being hunkered down for so long resulted in many people, especially kids, who were stuck at home attending school online. The pandemic led to a lot of mental health disparities being highlighted, so we're seeing a lot of bills that would support funding for mental health services here in Texas.
Maggie, Democrats had high hopes heading into this session that they would finally be able to get Medicaid expansion across the finish line coming out of the pandemic. What do you think went wrong?
Right. Yeah, this is something that Democrats have been pushing for years, especially ever since the Affordable Care Act passed back almost a decade ago now. That's something that Representative John Busey has been pushing year after year. He says it's the state's biggest failure every session when they don't get it to the governor's desk. So when we talk about expansion, we're talking about the 2.2 million Texans who currently qualify under the federal guidelines, but due to state guidelines right now, they do not qualify for Medicaid assistance. So when we talk about expansion, they don't meet the 138% poverty line that they would need to meet in order to qualify for Medicaid. And so, unfortunately, yet again, there was some bipartisan support actually for the bill this session, but it never made it onto the floor, so it never even got a vote. However, there have been some other slight Medicaid expansion. That includes expansion of coverage for pregnant women on Medicaid from 2 months to 6 months. So we're seeing at least some movement, some bipartisan support of Medicaid expansion here in Texas.